Margarita burn. The Pitt just introduced one of the weirdest medical cases yet. Warning: this article contains spoilers for the Pitt Season 2, Episode 8. The Pitt Season 2, Episode 8 introduces a truly bizarre medical case which is nicknamed Margarita burn, but how accurate is the depiction, and is this even a real disease? By and large, the Pitt has been repeatedly praised as being one of the most accurate and authentic medical dramas currently on TV. This is the result of in-depth research consultations with experts, and a genuine desire for the series to capture how it really feels to be a person working in the emergency department. However, it's still a show, and things are bound to get a little wild and dramatic in order to keep up the pace. So with the case of a new patient's intense blisters, these are the facts about Margarita burn. The Pitt Season 2 followed the rigid structure laid out in the premiere season, as a 15-episode arc follows the events of one lengthy shift in the ER. Season 1 saw the team working during a regular day that slowly turned into a nightmare when a shooting occurred at a nearby festival, but Season 2 immediately turns up the heat due to the 4th of July setting. Now, 8 episodes into the events of the day, 200 p.m. sees new patients arriving with increasingly intense injuries, including one man who has massive blisters that resemble burns all over his skin. Both Javadi and Ogilvy attempt to assess his condition, but it leaves them mystified before Joy Kwan appears and blows the case wide open by finding out the man had been preparing margaritas all day in the blistering heat. Margarita burn Lyme dermatitis, or scientifically speaking phytophotodermatitis, is a genuine condition, and it is in fact caused by prolonged exposure to the sun mixed with lime juice. Joy Kwan makes diagnosing the patient extremely easy after asking just the right questions and putting the information together. Of course, Javadi and Ogilvy also turn to Dr. Robbie for guidance on how to treat the patient, and they are able to provide the necessary care and suggest a strong sunscreen for use post-treatment, but it's a big win in an unusual case. When seeking accurate information about any medical condition, it is best to consult an expert, which is exactly what Men's Health did when they called on an experienced ER doctor to provide more context about the condition that is highlighted in the Pitt Season 2, Episode 8. Dr. Robert Glatter, their expert consultant, suggested that largely the diagnosis and depiction are accurate, but the show made an error, with the patient describing the blisters as itchy as opposed to painful. On top of that, the timeline of the illness appears to be altered in order to make it work within the context of the show. Typically, Lyme dermatitis manifests symptoms like those seen on the Pitt within 48 hours after exposure to sun and limes. It's completely unrealistic that the patient would have developed the condition after making margaritas that day. Instead, it's likely that they would arrive at the ER a day or two later,